As an art therapist in training, it is clear to me now more than ever that art needs to have a bigger place in helping people with mental illness. In this video, I want to explore the importance of art in the provision of mental health care.
He left no time to regret, kept his dick wet with his same old same.
The speed of technology and social change creates ever-growing pressures. People feel more alienated from a society they struggle to understand, and they find it difficult to articulate why. Across the globe, advances in technology and in healthcare mean that people are living longer, but these advances have not been matched by improvements in our mental health.
So far removed from all that we went through, and I tread a troubled track.
The result is that millions of us are affected by stress each year, with NHS figures showing 1 in 4 people in the UK are affected by a mental illness. Much of this modern stress can be put down to tangible things: getting onto the housing ladder, managing increasing debt, or caring for a sick family member. But so much of life isn't tangible and can't be put down to specific things. 19th century French sociologist called Émile Durkheim had a name for this intangibility. He called it anomie, and this is when society provides little or no moral guidance to individuals. Much of what we aspire to today is beyond our ability to reach. The perfect body image, the latest fashion, the perfect family, the blissful life. Like Durkheim's anomie, it's not always possible to put into words this unfulfilled longing that just being alive can bring. The World Health Organization defines health in a holistic way, as a state of complete physical, mental and social well-being, rather than just merely the absence of disease or infirmity. And I think this is where art therapy can really start to help, giving voice to individual people's pain and starting to view them in a more holistic way. And today, with more people experiencing mental health issues than ever before, the most significant thing that we can do is to take preventative action before things escalate. This will require individuals and communities to understand the circumstances which increase the risk of mental health problems. We need to look for a common understanding of what we can do individually and as a society, and how we can strengthen personal and community resilience in the face of adversity.
It's the friendliest he's ever been to me.
The Borough of Camden has some of the highest levels of mental health issues in the UK. It also has some of the highest levels of income inequality in any London borough, according to statistics published in the national news at the beginning of this year. High levels of income inequality are linked to economic instability, less community engagement, poverty, lower life expectancy and crime. In Camden, local data shows that 28,400 adults have diagnosed unresolved depression or anxiety. Camden has the third highest prevalence at 1.39%, which equates to 3,668 people with a serious mental illness such as schizophrenia. This is much higher than the London and England averages. To find out what these statistics mean on the ground, I decided to talk to a GP. Marek Kapersky has run a very large and progressive general practice in Camden for 35 years as part of the Kentish Town Health Centre. I wanted to find out how he has responded to the needs of the growing number of people with mental illness, and how we could get art therapy more embedded in the health service. Hi Marek. Can you tell me a little bit about your practice as a GP and the area that you work in?
Yeah, I was in Camden for 35 years until 2 years ago. I'm now working for the homeless, and I chose Camden because it's got very high levels of deprivation and very high levels of mental health illness compared with the rest of the country.
And within that time, have you seen an increase in the demand on mental health services?
Yeah, very much so, and in the provision. Much more provision now than there used to be.
This increase in demand for mental health services is particularly evident in the use of antidepressants. In the last decade, the number of antidepressant prescriptions has more than doubled. This could be due to a number of factors, such as increasing numbers of people simply coming forward. But it could also mean that more and more people are suffering from anxiety and depression. I wanted to know from Marek what he thought. Do you think there's a genuine increase in mental health related issues?
There's definitely an increased awareness, there's an increased provision, but also I think society has become much more stressful and pressured, and that has led to a greater need. You know, obviously the population is changing in its attitude, and people who, particularly men who would previously have hidden any mental issues or problems that they had, are now more likely to come forward with those. And government has become more aware of the issues of mental health illness, so there's more provision. And when you provide more of something, you automatically get more uptake. Gordon Brown did actually bring in an excellent CBT program, which allows referral, but also from professionals, but also self-referral, which is a really good thing.
In 2008, the Labour government introduced a new scheme called IAPT, Improving Access to Psychological Therapies. This was an NHS initiative to increase the availability of effective psychological treatments for depression and anxiety. Under this scheme, clinical outcomes are measured and recorded for patients who receive a course of treatment. The NHS 5-year forward view for mental health wants IAPT to provide services for 1.5 million people a year by 2020, as shown here. This will require the training of an additional 4,500 therapists between 2016 and 2020. A substantial part of this expansion will rely on a move to further integrate mental and physical health services through the development of integrated IAPT services. This is reflected in the general practice forward view, with the objective that there will be 3,000 therapists co-located in primary care by 2020. If the goals of these initiatives are fully met, this will have real benefit to our communities. I wanted to know from Marek how it's working in Camden and whether he sees art therapy as being part of the provision. Can you tell me a little bit about the psychotherapy provision within Camden?
Yeah, I think by comparisons with the rest of the country, it's always been very good, not least because of the Tavistock Institute locally.
The Tavistock Clinic in North London has long been regarded as a centre of excellence in its application of psychoanalytic ideas to the study and treatment of mental health and interpersonal dynamics. It was because of this commitment that the Tavistock joined the embryonic NHS in 1948.
The Tavistock supported us in our belief that mental health was a very serious issue and that it was a great part of the work of GPs.
So as a GP, you recognise the benefit of a holistic approach to treating a patient, so looking at the whole picture of physical, mental and social well-being. And where do you see art fitting into that picture?
Well, we thought that art was very important in the provision of help for mental health illness, not just in those that suffer severe mental health, but broadly across the population. And there is no formal provision of this from the NHS at community level. So when we got a large donation from a patient, we were able to set up a charity and then apply for lottery funding, and that allowed us to get a full-time person in to run initially an art gallery and then various other services to help people with their mental health issues.
That sounds amazing. Are there other places across the UK that do something similar?
Not that I've heard of, but I wouldn't be surprised. The essential problem is that the NHS doesn't fund this sort of thing because it's not evidence-based. And there is a real problem for art and evidence, because how do you show it? It's very hard to quantify something that affects the whole of a person and involves lots of things that are not measurable.
Great projects like the one at Kentish Town Health Centre are a beacon for a more holistic approach for mental health in primary care. But if we are to deliver the goals of IAPT and the general practice forward view, we need more of them.
Although the decision makers in the NHS say and probably believe that they make their funding decisions on the basis of evidence, my experience of working in the administrative system of the NHS is that is not really true. That people make decisions on the basis of their intuitive experience, and then they try and gather the evidence afterwards to support what they want to do anyway. Of course, the art world needs to focus on trying to get hard evidence to support its beneficial effect on people in mental health illness. But it should also realise that should not be a block. The absence of evidence should not be a block.
So I think that now, more than ever, it's down to us as art therapists to make our own case. We need to be the ones looking for funding to deliver on exciting new pilot projects. And they need to be run by art therapists so we can gather the hard clinical evidence to support commissioners to make their decisions. Because I believe that art really can play a major role in delivering the goals of a more holistic health service.